Well, joining us to talk a little bit more about face masks and coverings is Dr. Nancy Sudak of Duluth, a physician who practices integrative health. We appreciate you joining us here, doctor.
My pleasure. Thank you for having me.
You recently wrote a column in the DNT titled, "If you care about others, please wear your mask." Why is it so important to you for people to wear masks in public?
Well, because in addition to physical distancing and to proper hand washing, one of the most significant ways that we can prevent the spread of the virus to other people is to wear a mask, and we really wear the mask to keep ourselves from spreading our own germs to other people. We can get some protection when we wear a mask if somebody else has the virus, but not very much protection. Really, the point is to prevent transmission ourselves. And I think also because I've seen, a little bit of apathy when I go into the grocery store, and I'm seeing people not wear masks, and it's clear to me that there's some people who simply don't understand that we can transmit the disease without knowing that we have it. So it's very possible to have no symptoms at all and to still be contagious.
We just ran a story on a spike in COVID-19 cases in many states. If people in those states almost entirely were wearing face masks, would we be seeing any kind of spike there?
Well, unquestionably, it would be making a huge difference. And so, if you and I are in a room together and I have COVID and you don't, if I wear a mask, your likelihood of getting COVID is significantly reduced. If we both wear a mask, then your likelihood of getting the virus transmitted to you is even further reduced. So yes, the more mask wearing we do, the less transmission we're going to have.
There have been a few mixed messages. University of Minnesota Director of the Center for Infectious Disease Research and Policy, Dr. Michael Osterholm, has taken a different approach in language when it comes to masks. He's referring mostly to cloth masks, not N95 masks, but cloth masks, saying those tiniest particles called aerosols can get in the sides of masks, and COVID can still be transmitted in that way. He also worries that people wearing cloth masks can kind of create a false sense of security when it comes to social distancing, leading to a lack of social distancing. How do you respond to that kind of analysis?
I think we have to do everything possible that we can do. Wearing a mask does not pose a health risk for the vast majority of people. It's a very simple thing that we can do, and it will reduce the transmissibility of the virus. And so it's not 100% protective, just as an N95 isn't 100% effective in transmitting the exchange of tiny particles. But it's true, a cloth mask is certainly imperfect, but it is way better than nothing, in my opinion.
And important, no matter what, to keep on social distancing, even with that mask. Dr. Nancy Sudak, we appreciate you joining us here this evening.
My pleasure.